Bismillahirrahmanirrahim. In this video, I am going to describe the health screening of pregnant women before starting exercise. The first step before planning to start or continue an exercise program during pregnancy is the health screening of the women by a healthcare provider. Overall health and medical and obstetric risk should be reviewed. So, in this regard, there are some subjective measures which are most commonly used for health screening during antenatal time. The most valid or the most reliable subjective tools which are used is number one, paramedics, which is physical activity readiness medical examination for pregnancy. This is the next one is physical activity readiness questionnaire, and the third one is ACSM, exercise pre-participation health screening questionnaire for exercise professionals. So I would like to explain the first one, which is very important, paramedics. This is the most updated checklist which is used in pregnancy for health screening. It is very convenient. It is used worldwide. It has been undergone through many translation in different languages, in English, in French language, in Brazil, in Portuguese and Spanish. It has four components or four parts in it. Number first part assess the or screen the general health status of the female. The second part is about the subjective assessment of the current pregnancy. So what are the current signs and symptoms of the current pregnancy? The third very important component of paramedics is the daily activity habit, and the fourth part is the relative contraindication and absolute contraindications. So these component, it is important to know that these component or this questionnaire is filled by obstetrician and gynecologist who do pre-screening on behalf of a fitness professional, and then after screening their patients through this subjective measure, they refer their patient to the prenatal fitness professional. The second very important tool which is used for health screening of pregnant female is physical activity readiness questionnaire. This is for everyone, and it is available at ACSM site or publications. So this is filled by the fitness professionals, and this tool is basically to progress in more physical activity. So in order, if the client is following the sedentary lifestyle, so this questionnaire is used to screen that activity, and then we can progress on to the lighter mode. And if the patient is already doing some light activity, we can progress to the moderate, and then so on. And the final health screening tool, this is also the subjective one, and this note down the symptoms of the patient, or the current symptoms definitely of the current pregnancy, and then what is the current activity and what are the medical conditions at the time when you are screening your patient, or the past medical conditions of the patient or the client. So these are the three main subjective tools which are used for the first step of exercise prescription and testing, which is the health screening of your antenatal client. Thank you so much.